The feeling of being completely alone and being very scared and having really no control over the outcome. This is what you experience when you are facing down the medical cartel. Just an unfeeling, uncaring bureaucracy, and you are left completely to your own to try and figure out what's going on and how to fix it. And it's very frightening. It's very scary because you realize how little you can actually control. And you, of course, are not a medical professional. You have no medical training, but you realize very quickly that all of the doctors and medical professionals you're dealing with don't seem to know very much either. They are just kind of like robots, bureaucrats. They read from the same script. They run tests, they run blood work, but they have no intuition about what they're doing. They have no desire to help you. They have zero compassion for you, and they really couldn't care less what the outcome is for you. If you're lucky, what your condition might fit within their box. And if it does, then they can figure out what it is and they can treat you. Notice the subtle change in language. The modern medical cartel talks about treatment. They never talk about cures. They have no interest in curing you. And most of their diagnoses are really just a description of your symptoms, not really an actual root cause. They don't do root cause analysis. But I wanted to go into some of the psychology of being in this position, but it's difficult to do and it's impossible to describe anyway for someone who hasn't been there. And while I think there are similar stories out there, I also think everyone's story is unique. You can never honestly say you understand what somebody else is going through. That's not possible. Everyone's experience is unique. I think the things that makes mine the most challenging is the not knowing, right? If you get diagnosed with stage 4 cancer, well, that's a scary thing. And nobody wants to be diagnosed with stage 4 cancer. And I don't want to poo poo that or make light of how terrible that would be. But at least you know what you have. You know what you have. I don't know what I have. And the doctors don't know. And they have no interest in finding out. They seem to be more interested in winning arguments with me, proving that they're right and I'm wrong. They know more than I do. And they seem to be more interested in imposing their will on. There are multiple times where they want to try something. I know it's not going to work. My intuition is telling me this is all wrong, but I let them bully me. And when it doesn't work, they never even acknowledge that it's not working. They're happy because they successfully impose their will on me. That's what they're interested in. And when you're in a fragile mental, emotional, and physical state, as I am, it becomes pretty easy to bully me. So there's a great feeling of being lost because you don't know what you have. You don't know what's going on and you have zero control over it. And your health issues put you in a position where you have mental fog all the time. So you cannot even make good decisions. Things that would normally be relatively straightforward to deal with, you cannot deal with. And there's nobody helping you. So it becomes a bit of a vicious cycle. So you're alone, you're scared, and you cannot really figure anything out. You don't know what you have, when it might come, when it might go, how long it might last, how bad it might get, whether it might get better or worse, and you are completely alone. There is no one who is advocating for you. The doctors are not there to help you. You have to be your own advocate when you're in no mental or emotional state to be your own advocate. You have to try and figure out what's going on when you have no medical training at all. And the doctors can only help you if you are able to hold their feet to the fire, figure out what exactly needs to be done, and basically hold their pen to the paper and make them do it, even if even what you're asking for can be done by them. So I think the overarching feeling is one of fear, fear of the unknown. And that's exacerbated by the fear, the thought, the reality of being alone. There's no one in the quote unquote system who has your best interests at heart. The doctors might be able to help you, but if they do, it's not because they care at all about you or have any compassion for you. And that's, again, I'm trying to describe something that is impossible to describe. Some people, I'm sure, have had similar stories, similar experiences, but at the same time, it's never exactly the same. Everyone's story, everyone's experience is unique in its own way. But sadly, I think most people have gone through something similar themselves or seen a parent or a grandparent or in laws or children or spouse go through something similar. And it's very challenging, very challenging. In my case, no one really knows what the root cause is, and no one seems interested in figuring it out either. No one wants to go through the difficult process of really listening to me, examining whatever evidence we have, and attempting to figure out what's the root cause. And then how do we address it? Everybody wants to jump straight to a pat solution without first really listening to the patient because they never really listen to the patient. They barely let you finish, and their way of quote unquote listening is really just to pick out keywords so that they can put you into a box, or they give you run tests, and all of their supposed treatments are based on what the machine tells them, what the blood work tells them, not what their own intuition tells them, not what they learned from listening to the patient. Because in my line of work, both currently and back when I was a full time employee, the most valuable data you will ever get by far is the data you get from the client's own mouth. You can run numbers, you can have spreadsheets, you can go through the data, that's fine. And you need to do that. Yes, that's part of your analysis. But what really separates the good consultants, the good financial professionals from the decent ones is how well do they listen to the client? How well do they really understand the client? Because that is the most important component in everything. And it's the same thing when you're trying to treat a patient. The most valuable data that a doctor could ever get, if the doctor cared, is what the patient tells you himself. And doctors have no interest in listening to the patient. That's hard. And they don't want to do something that's hard. They just want to put a check in the box, make sure the insurance company pays them. So, unsurprisingly, I've found that the medical professionals who are the best are those who do not take insurance, generally speaking. Some of them are good, most of them are mediocre, and most of them who take insurance are working in a system that does not provide them a financial incentive to really help the patient. They don't need to work to attract customers, attract patients, because there's an artificially created shortage of doctors. And so the doctors have all the power in the relationship, and you, as the patient, are powerless. But, you know, I have so much PTSD associated with dealing with medical professionals of any kind, going to a hospital or doctor's office of any kind. And when things start going better, I don't want to speak about it because I fear I might jinx it. Kind of reminds me of that scene from Gladiator where the emperor, before he dies, is talking about how Rome was just a whisper. And he didn't want to speak it too loudly or else it would vanish. And I feel like it's the same thing with my health. If things ever start going better, I don't want to jinx it. I don't want to talk about it too much out loud because I know it can always go south with no explanation. With no explanation. Um, but I will say that thanks to some very painful therapy I've been going through with one of the better medical professionals who, surprise, surprise, does not take insurance, gets paid directly in cash, coupled with some lifestyle changes and other things that I've been doing, some of my symptoms seem to have improved lately. They had been getting better, then they had been getting worse with no explanation. Now they seem to be getting better, and I cannot say I'm exactly sure why, but I think reasonably it's a combination of this therapy and some of the other things I've been doing, all of which I discovered on my own, by the way, or most of which I discovered on my own, or at least had to coax the ideas out of the doctors, suggest, hey, why don't we look at this? Um, that is one of the things I've learned, at least for my particular condition. It seems to be no pain, no gain. So the more painful options seem to have actually worked better, even though obviously it's not pleasant. But I still have that overarching feeling of being completely alone, having no advocate, faced against a totally unfeeling, uncaring sea of bureaucrats who don't listen to you. Nobody really wants to listen. Um, and nobody really wants to, hey, well, nobody wants to listen. Just stop right there. Lots of people want to give me a quote unquote solution, but I didn't ask you for a solution, did I? First, you have to back up a step and actually be willing to go through a painful process of listening. Because obviously, if there were a pat easy solution, if it were just about diet and lifestyle, if it were something that worked for your aunt, probably would have figured it out by now. But no one wants to even try and diagnose you. They just want to jump straight to, well, try this, try that, try this, try that. And that gets very, 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 very old, just throwing stuff against the wall to see what sticks. The number one guiding principle I've had that has been the most accurate has been my own intuition. And whenever the doctors or anybody else says things that don't jibe with my intuition, they're generally wrong and my intuition is generally correct. And I cannot articulate my intuition. When, on the other hand, I hear something from a doctor, a medical professional that jibes with my intuition and I follow it, then those tend to have better results. But it's still a very challenging situation. I had not gone to make an update, so I thought I would go ahead and make one. I do not enjoy doing these. I do not enjoy talking about myself at all. But I think it's hopefully helpful for the audience. I've gotten feedback that it is helpful. Um, Perhaps it builds some sympathy for me. Uh, and I do know, unfortunately, other people have similar stories, but the overarching feeling is one of fear um, and being alone. And it's a continual reminder of how little we can really control in this life, how little we can really control in this life. The only thing each of us has control over is our own weakened will, weakened from original sin. That's the only thing we can control, nothing else. We cannot control any of the other external circumstances we find ourselves in. And it's hard to believe, but there is a divine providence out there who ultimately wants what is best for us, even if we cannot see how the suffering and the darkness we're going through is for our benefit. We will see it at the end of time, even if we cannot see it now. Just like when the 2-year-old tries to run out into the middle of the street to chase his ball that got away from him, and his mom grabs him, pulls him away from the street, and he starts screaming because all he sees is he lost his ball in the street. He doesn't see the traffic oncoming to hit him. He doesn't see the danger. And that's kind of the way we are. We just see our suffering. We see that we're not getting what we want or what we think is going to make us happy. We don't see the bigger picture. We cannot see the bigger picture. We have to just trust. That probably comes across as somewhat cliched, but I can say I'm living that right now. It's not at all easy to trust in divine providence. It can seem easy when things seem to be going well for us, but that's because we're not really being tested or challenged. So things are symptomatically like no breakthrough, nothing's been discovered or anything, but symptomatically things have been going a little better lately. I'm just really afraid to say that out loud because I fear I'm going to jinx it now. And everyone's going to just give me a condescending pat on the head and say, that's great. Everything's wonderful because that's what they want to hear. They don't want to hear the truth, which is much darker and much more painful than that. But I continue to do my best and I continue to learn a lot and grow a lot in very difficult and painful ways. But I hope this update was helpful. And I hope those of you who are dealing with your own mysterious health challenges and trying to navigate the medical bureaucracy can take some solace in knowing that you are not alone. There are many other people suffering like you.